Good morning, everyone. Welcome to Orange County Plastic Surgery. I'm Crystal, the PA here. I work with Dr. Juris Bunkis, our plastic surgeon. Today we're doing some hormone pellet insertions. We have a male and a female patient coming in today. And the hormones are great for replenishing your energy, giving you your sex drive back, on a whole slew of symptoms. So come in, check us out, see if you are a candidate for these pellets. It's quick, it's easy, it's safe. And get rid of those patches, creams, and daily routines, and see if we can help you out with some pellets. It's really simple. We do some lab work, and we enter your data into a system, and it spits out what your dosing is going to be. You do it right here in the office. It is a sterile procedure, and it only takes about 5 minutes, and you're in and out every couple of months. So that is our little estradiol pellet, and we have some testosterone pellets going in as well. Females can have estrogen and testosterone. Males just get testosterone. So we've made our marking site. So this first spot here is where our incision will go, and the second dot out here is the goal of where the pellets will sit. So you want to make sure that they're not over the sits bone, so where the patient's going to be sitting on these, or rubbing under where their pants or their belt might lie. So now we're going to sterilely prep the area. So this is ChloraPrep. Really get the entire area around it nice and clean. We like to use ChloraPrep compared to betadine. Betadine can cause some irritation of the skin if left under tape. We don't seem to find that same reaction with ChloraPrep. So now we're going to drape the area. So we keep our area where we're working nice and sterile. So this is all a sterile field now, so I can touch this area without getting my gloves dirty. So now we will draw up our local anesthetic. So we've now filled our syringe with our lidocaine with epinephrine and some sodium bicarb to help the kind of sting. Use a much smaller needle for injecting that local. So again, this is our first marking point. We're going to make a little bit of a wheel, as we call it, where you just see a little bubble of the numbing medication going in, then we'll use that to kind of drive into where we're placing the pellets. All right, so you're gonna feel a little pinch and a little burn. Pinch, 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 little burn. Doing okay? Mm-hmm. Make this nice little wheel here. Alright, a little burn. Doing great. Really want to drive that hub so we get the medication, the numbing medication, past the point of our tools and our trocar, so that when we place the pellets at the end of the procedure, they pop into an area where there's some numbing medication. So this stuff kicks in pretty quickly. I've got my sterile gauze here. We just kind of give it a little rub. And as soon as that kicks in, I'm going to start putting my trocar together. So give her another second. So as you can see, this is my trocar here. We have the end that looks like this that we apply with, and then this blunt end to put the pellets in so we're not crushing the pellets as we insert them. Our patient today is getting some estrogen and some testosterone. So you can see there's a couple different size pellets depending on the dose of the pellets, so we'll be placing those today. So now we'll be making a small incision. Feel anything here?
Nope.
Okay. There's a small incision here. We just insert the tip and then work our plunger, or trocar rather, to the area above here. Doing all right?
Yes.
Awesome. Okay, so now it's in the place where we want it. And what we do is we take our little cup, helps us keep from losing any pellets, and that's going to stay under here while we're placing the pellets. So pick up our pellets. And on a female, you can just put them all in at once because there's only usually just a few. On a male, it's a little bit different, and I'll show you that next. So now that everything's in place where it should be, I grab my blunt end of my tool, place it in, drop it down so we're seeing in the subcutaneous area, pop them in, and that's it. And you can pull the tool out nice and easy. And then we do a little bit of glue and some steri strips to keep everything nice and closed. And then we'll put a small piece of gauze here with another piece of tape and she'll be good to go.